First of all, my name is Kinker Mishra. I'm working as senior research scientist at BioSensics. Now, the technology we demonstrated was called as BioDigit Home. And the objective was to have multimodal assessment of disease symptoms in dementia. Uh, so what we think is like the motto of our company is we cannot manage a disease if we cannot manage its symptoms. So now dementia is not single aspect that we can focus on, but it needs to be assessed from different angles. But the problem is we have different technologies, but they don't speak to each other. So, for example, speech is a crucial aspect. It may deteriorate as the cognitive impairment increases. Frailty is another aspect. Life space is another aspect. So, the BioDigit Home is that technology which brings together these technologies at one platform. And then what we do is we do multimodal assessment of disease symptoms in dementia. So the technologies we presented was called as BioDigit Speech. It's a proprietary pipeline that we develop. So in this technology, what happens is we give a tablet to the patients, they take it at home. So this tablet is called as BioDigit Home. Once they have that tablet at home, they record or they perform some pre-specified or standardized speech task. Now, when they perform this task, we record their speech and we transfer this speech through our server through a BioDigit cloud in a safe and secure manner, which is compliant with HIPAA. Once we have that speech with our proprietary pipeline, we use AI to assess this speech when they are performing this task. So the task is basically they have a passage on the tablet, they have to read that passage and our pipeline it analyzes that recorded speech to give different outcomes. For example, how many pauses were they taking when they were reading this passage, or what was the pitch of reading this, or what was the loudness and let's say speech to pause ratio or overall voice time, how much they were speaking throughout while reading this passage. Now, the idea is when we have all these outcomes, we used our machine learning model, which is like basically focused on deep learning module. So it used the deep learning to see or basically provide a score for their dementia or cognitive impairment. So that was the idea. There are a lot of technologies or research technologies are coming up, but it's very important that the technology should also be commercially viable. Like it should be scalable and should be easily used in the current clinical settings. And that's the main focus of BioDigit speech. So speech is particularly interesting because for speech, when someone is speaking, let's say if I ask you a question, let's say you have to tell 5 words which are related to supermarket or groceries. Now you will tell me some words like, okay, it can be apples, bananas, spinach, milk. So you are constraining your thought process into a particular category which is involved with the groceries, right? But in the case of people with cognitive impaired people, they are not able to think in the context. They are not able to come out with the terminologies very fast. So if we can record these kind of speech assessment and see how many pauses they are taking, how much time they are taking to finish this kind of task. This is just one example, but let's say we assess this and see how many pauses they are taking, how much time they are taking to complete this task, then we can assess that cognitive impairment. Now, the idea is the speech can be, all you need is recording the speech and then use ML to process it. So it's scalable, commercially viable, it's cost effective.